Welcome to Smart Wellness Tips, where we navigate complex health decisions to help you live a longer, happier, and informed life. Today, we tackle a critical question facing millions of men worldwide. Should you get the PSA test for prostate cancer screening? This decision is not always straightforward, as medical advice has evolved significantly over the years regarding the benefits and potential risks. To make the right choice, you first need to understand exactly what we are testing for and how this mechanism works. We will guide you through the science, the statistics, and the emotional journey to help you decide what is best for you. Let us start with the basics. PSA stands for Prostate-Specific Antigen, a protein produced exclusively by cells in the prostate gland. Under normal conditions, these cells release this specific protein into your bloodstream, where it can be measured through a simple test. The prostate is a small gland, but it plays a massive role in male reproductive health and overall physical well-being. However, when prostate cells begin to multiply rapidly, as seen in cancer, the amount of PSA entering the blood increases significantly. This elevation in protein levels is what doctors look for. It serves as a biological red flag, indicating potential underlying issues. Detecting this rise early can be crucial, but it is important to remember that a high number is not a diagnosis. While cancer causes these levels to spike, it is not the only factor that influences the amount of antigen in your blood. Understanding the nuances of this test requires looking beyond just the numbers and considering your unique lifestyle and medical history. Modern medicine gives us these incredible tools, but interpreting the data requires wisdom, caution, and a deep understanding of human biology. Your PSA levels are dynamic. They can change from day to day based on various activities, not just the presence of disease. This brings us to the major limitations of the PSA test. A high score does not automatically mean you have cancer. Common conditions like benign prostatic hyperplasia, or BPH, which is simply an enlarged prostate, can cause significant spikes in your results. Inflammation or infection in the prostate gland is another common culprit that mimics the chemical signature of cancer in blood tests. Even everyday physical activities, like riding a bicycle, can temporarily spike these levels, causing unnecessary alarm and confusion during your medical checkups. Here is a startling fact to consider. 3 out of every 4 men with elevated PSA levels do not actually have cancer. This means a large majority of men undergo unnecessary stress and follow-up procedures because of a false alarm from this screening. Conversely, there is a 15% chance that you might still have cancer even if your PSA results come back negative. This margin of error creates a complex dilemma. The test is a useful tool, but it is certainly not a crystal ball. So, who should actually take this test? Doctors divide men into 2 distinct categories to help navigate this difficult medical decision. The first group includes those with clear symptoms. If you experience difficulty urinating or frequent visits to the bathroom at night, if you notice a weak urine stream or other urinary irregularities, testing is not just optional. It becomes a mandatory medical step. For symptomatic men, the PSA test is a critical diagnostic tool to identify the root cause of the physical discomfort being experienced. The second group consists of men with no symptoms but who are worried due to age, family history, or personal anxiety. Family history plays a significant role. If your father or brother had prostate cancer, your risk profile changes dramatically compared to others. Often, the pressure comes from loved ones who want to ensure you are safe, adding an emotional layer to this medical choice. For asymptomatic men, the decision is a trade-off between the potential benefit of early detection and the risks of overtreatment. If your result is positive, you enter what we call the emotional vortex. A positive test triggers a cascade of further investigations. The next step is often an MRI scan, a detailed imaging procedure to look for suspicious areas within the prostate tissue structure. If the MRI shows abnormalities, you may need a biopsy, where small tissue samples are taken directly from the gland for analysis. These procedures carry their own risks, including infection, pain, and bleeding, which adds to the physical and mental burden of screening. The biopsy results generally fall into 3 categories: completely normal, low-grade, slow-growing cancer, or high-grade aggressive cancer requiring immediate action. If it is normal, the relief is immense. However, you have just endured weeks of high anxiety and invasive tests for nothing. If it is low-grade cancer, it grows so slowly that it might never harm you. You may live with it for decades. In these cases, doctors often recommend active surveillance. This means no surgery, just regular monitoring to ensure the condition remains stable. But knowing you have cancer, even a harmless one, can be psychologically damaging. It creates a constant background noise of worry. On the other hand, finding an aggressive cancer early is a life-saving victory. Immediate treatment can completely cure the disease. This is the scenario everyone hopes for when they screen, catching a dangerous killer before it has the chance to spread. So, the ultimate decision comes down to your personal values. Do you value the peace of mind of knowing the truth? Doctors' experience shows that most patients, after hearing the risks, still choose to test. The fear of missing cancer is powerful. They prefer to face the potential anxiety of a false alarm rather than the regret of missing a treatable, aggressive disease. Our advice is to have an open, honest conversation with your doctor. Discuss your fears, your family history, and your preferences. There is no single right answer for everyone. The right choice is the one that allows you to sleep soundly at night. Taking control of your health means being informed, not just following trends. It is about understanding the science behind the tests. Remember that you are the captain of your own health journey. Medical tools are there to serve you, not to control you. Whether you choose to test or not, maintaining a healthy lifestyle with good diet and exercise remains the best defense against disease. Focus on what you can control every day. Nutrition and physical activity are proven ways to support prostate health naturally. Stay connected with your community and talk to your friends. You will find that many men share the exact same concerns. If you have been putting off this decision, make an appointment today. A simple conversation can lift a heavy weight off your shoulders. Your doctor is your partner. Use their expertise to navigate the complex statistics and find a path that suits your life. Prostate health is deeply connected to your hormones and aging process. It is a natural part of being a man. Don't let fear dictate your choices. Let knowledge and clear understanding be the guiding lights for your medical decisions. Medicine is always advancing. New tests and better screening methods are being developed to reduce false alarms in the future. Until then, the PSA test remains our best initial screening tool, despite its flaws. It has saved countless lives through early detection. If you found this information helpful, consider sharing it with the men in your life. It might just save a life. We hope this deep dive has clarified the confusion surrounding the PSA test and empowered you to take the next step. To recap, PSA helps detect cancer, but has false positives. Symptoms require testing, while asymptomatic men must weigh risks versus benefits. Keep a record of your health. Tracking changes over time is often more valuable than a single isolated test result. Time is your most valuable asset. Investing time in understanding your health now pays dividends for your future quality of life. Managing the anxiety of screening is just as important as the screening itself. Mental health and physical health are inseparable. Listen to your body. It often whispers signs of trouble before they become loud alarms. Trust your intuition and seek help. Protecting your health is also an act of love for your family. They want you around for as long as possible. Life is beautiful and worth fighting for. Don't let the fear of a medical test stop you from living fully. Walk out of the doctor's office with confidence, knowing you have made an informed choice based on facts, not just fear. Support your friends and colleagues. Open conversations about prostate health can remove the stigma and encourage others to get checked. Awareness is the first step towards prevention. By watching this, you are already ahead of the curve in protecting yourself. If you have more questions, never hesitate to ask your medical provider. There is no such thing as a silly question. Your health is your responsibility. Take charge today. Schedule that checkup and have that important conversation with your doctor. We want to see you thrive. Your well-being matters to us, and it certainly matters to those who love you. Thank you for trusting us with your time today. We hope this guide brings you clarity and peace of mind. Thank you for watching Smart Wellness Tips. Please subscribe for more guidance on your health journey. Stay proactive and stay healthy.